As the pandemic presented itself, we knew that in many of our communities, and as the data started showing, disproportionately they were being affected. And disproportionately, there were not testing sites in many of our communities. And so as a community leader, leadership in community health, we thought it was very, very important that we step up and really are able to let our patients know what their status is. And so as we started that approach, we didn't start by just looking at how we thought it should be rolled out. The science behind it, we got all of that, but getting patients, getting the community engaged in the process up front was very, very important. One of the things that I'm very proud of the organization is our legacy of never being a medical-only model. Being able to have built trusted relationships in the various communities that we are in, it's really part of our hallmark. It's never been a transactional relationship. It's really one that's been built on trust. And so we did our outreach efforts. We called on our community partners, I think up to 200 community partners, that we wanted them to give us guidance. I enjoyed being able to hear from the community and really getting that pearl of knowledge of them telling us the best way to approach. And I think with that, as we proceeded not only to put together testing sites that were safe, but that also was supportive, but also the education material, one where we knew what are going to be some of the vital questions and information that our communities would need in order to protect themselves. And the interesting piece, there's a lot of similarities, but all of our communities are different. And we wanted to have a genuine approach that really matched the needs of particular communities, whether you were in Englewood or Auburn Gresham, or even in a suburban market. We really wanted to make sure that we put together a testing site and not looked at it again as intervention or a way that we were just doing testing only. It's about health.